Okay, hello everyone. My name is Ami Patel with the Administration for Community Living, and you have joined a informational webinar on a new funding opportunity to provide critical relief for COVID-19 pandemic responses for the Aging and Disability Resource Centers across the states and territories. Again, thank you all for joining us, and we can move forward to a few housekeeping items. Okay, so just a few housekeeping items. All of the lines are muted, and they will remain muted throughout the webinar. So we ask that you use the chat feature to submit any questions you have. This webinar will be recorded, and the recording and the slides will be posted to the acl.gov website. Quick overview of the agenda. We will walk through various sections of the FOA and review important pieces on the use of funds, the application process, and at the end, we will have plenty of time for question and answer. So again, keep in mind that you can submit your questions via the chat feature at any time. Okay, to start with a little background on this funding opportunity, this emergency funding is a result of the CARES Act that was passed by Congress a few weeks ago to provide critical relief to states and territories with designated ADRCs who are working at an unprecedented pace to combat and respond to the COVID-19 pandemic. This is in specific response to the urgent need you all have now to support the capacity of the Aging and Disability Network and increase all efforts to coordinate services and overcome these new challenges. And as we know, ADRCs are well positioned to provide essential services and support at the time of any emergency, providing information assistance, person-centered counseling, and care coordination to the most vulnerable populations becomes even important during these times. And the state's No Round Door system provides the infrastructure to coordinate these efforts statewide and support streamlined access for older adults, persons with disabilities, and their caregivers. So moving on to the funding opportunity, the purpose and goals. As noted earlier, this is specifically to support states and territories with designated ADRCs to immediately respond to COVID-19 needs. And more specifically, this funding opportunity will help to address things like a virtual workforce and any challenges related to that, supporting things such as adverse effects of this pandemic, such as social isolation, and any unique challenges with accessing critical social and health needs at this time. Eligibility information on the next slide. All states and territories are eligible to apply, but ACL will only review one application per state and per territory. So it's important that you coordinate across key stakeholders and key partners at the state level to submit one application. The key requirements include identifying a lead agency at the state level and providing a list of all of the designated ADRC organizations at the local level. Additional requirements on the next slide include that the applicants will be required to conduct a rapid assessment of the existing landscape and workforce needs at the state and local level. And the purpose of this is to be able to quickly identify the most critical needs and to best understand how to use these funds in a rapid fashion. So whether it's preparing for a peak in the number of COVID-19 in your state, COVID-19 cases in your state, or understanding what happens next and how to support people in a recovery process once things hopefully slow down. And so again, ACL will only review one application and fund only one agency per state or per territory. So next is the use of grant funds. We've listed so on the screen now you should see the eligibility information and key requirements. So I'll just repeat myself one more time here. Again, all states and territories are eligible to receive funding, but we will only review one application per state. And the requirements are that there should be a designated lead agency at the state level. And applicants are encouraged to, of course, work with key stakeholders. And again, applicants are required to do a rapid assessment of their workforce to best identify how to quickly use these funds during this critical time. So now, where we had paused for a second, back to the potential use of funds. So on pages 2 through 4 of the FOA document, we have outlined a list of potential uses of funds. Applicants are encouraged, of course, to align their activities with the state's overall emergency response efforts. But of the activities that we have listed, again, the first activity is a requirement. We, again, are asking states to complete a rapid assessment of their ADRCs, and ACL will provide technical assistance to grantees and share some examples of how to do these types of assessments. But other potential activities or use of funds include enhancing virtual workforce capabilities, supporting the increased needs of care transitions from hospitals or nursing homes or any other setting back to the community and all of the unique challenges with that. Mitigating social isolation by increasing capacity to provide follow-up with individuals. And again, these are just a few examples, but more details can be found on pages 2 or 3 of the FOA. And then the application submission requirements. What we are stressing here is that the intent for this is to make the application process as simple as possible. So we are only requiring a one-page project narrative that describes the geographic coverage area of the designated ADRCs across the state or territory and a brief description of how funds will be used. So again, emphasizing that it's just a one-page submission process. We don't expect a lot of detail here. We fully understand that how you ultimately use the funds may change as we move along in the next couple of months. And so part of our ongoing technical assistance plan is to be in touch with grantees throughout the process and to keep track of the activities and how you are spending those funds. So as far as the application process, just describe how you plan to use them as best as you can in just one page. And then in addition to the project narrative, there are 3 other documents required for the application, the SF 424 and 424B. Those are normal forms that are required for all grant submissions, and then a budget narrative with justification. And an important note here about the budget narrative, the funding amounts per state and territory have been determined by formula, which was based on population estimates of individuals 60 and over and individuals of all ages with disabilities. So for a breakout of these funding amounts, please refer to the frequently asked questions document, which has been uploaded to acl.gov/COVID-19 page, and we can provide the exact link to that here in the chat. And next, the important due dates here. The applications are due next Wednesday, April 15th by 11:59. The submission process is through grants.gov, which is how you submit grants through normal processes. So further instructions on that process can be found on pages 5 and 6 of the FOA. And we fully understand the quick turnaround time here. But again, why we did this is to make the submission process as simple as possible. Again, you have just one-page narrative to submit. And ultimately, we know states have a critical need for these funds now. So the sooner we receive your applications, the faster we can process it and the faster we can get the funds to the states. So our review process is going to be expedited as well. And if we receive your applications by April 15th, we hope that we can notify you of the award by the end of the month. However, if states cannot meet this deadline, we are willing to work with you. It's just important that you reach out to us directly as soon as possible so we are aware and can provide you additional support if you cannot apply by April 15th. Again, the ultimate goal is to make sure that all states and territories take advantage of this opportunity. So please reach out if you cannot submit your application before April 15th. And there's contact information provided here on the slide, and my contact information is throughout the FOA document. So again, please feel free to reach out. And then next, we wanted to provide a link to the ACL.gov website where you can find all information related to COVID-19. If you scroll halfway down to where it says information for aging and disability networks, you'll see an area that also says Older Americans Act program. If you click on that, you'll see a section specific to this FOA where you can download the frequently asked questions, and this is also where we will post the recording of today's webinar. So we kept today's slides and information as simple as possible because we know your time is valuable and we appreciate you being on today's call. So we wanted to go ahead and open it up for question and answer. We have plenty of time here, so please do continue to submit your questions through the chat. And so I'll pause for a second while we sort through the chat and continue with questions.
Hey, thanks so much, Ami. And a huge apologies to everyone for the technical difficulties. We actually lost power, I think 2 of us that were hosting. So thank you so much for picking up the slack, Ami. And we are going through all of the chat questions right now. We've got lots coming in. So we can start off. We have a question asking, is the slideshow available for download?
Yes, thank you. We will post these slides again on that same webpage, acl.gov/COVID-19. So we'll post the slides, the frequently asked questions, and a recording of today's session.
All right, we've got another question here. Can funds be used for technology to facilitate remote operations?
Yes, that's a great question. Funds can definitely be used to support remote and virtual working. We know that ADRCs are doing things very differently. Everyone's working remotely, and there may be some needs to enhance those technology capabilities. So absolutely.
All right, we have another question. We're working with our state AT program to provide iPads on loan to ADRC consumers as a way to help address isolation and loneliness. However, the iPads require internet. Can these funds and/or other COVID-19 relief funds be used to purchase internet for consumers?
That's a great example of how states might be using these funds in unique ways. And we actually do mention that partnering with the Assistive Technology Act program is a key opportunity with this funding. And the answer to your question is yes. I think that's absolutely appropriate. And in these times where everything's remote, again, internet access and using things like iPads is very important. So I do think that's an appropriate way to use funds.
We have another question here. Can you provide a worksheet/guide for ADRCs to complete for their rapid assessment?
Yes, absolutely. We do hope to provide some direct technical assistance with resources and tools for different types of assessments. We have also outlined some of that detail in the frequently asked questions that we'll post after this. But yeah, right now our priority is to get these applications in and get the funding out to you all. And then soon after, we'll be sure to share some more information to all the grantees about how to complete those assessments.
We have a question asking if the webinar is being live captioned. So I will say it's not being live captioned, but it is being recorded. We will have to double check to make sure that our loss of of power and connection at the beginning didn't impact this? And if so, we can work on a transcript to share. Ami, would you agree with that?
Yeah, absolutely. If the recording did not work, especially, we can be sure to upload some notes so everyone has it.
All right, we have another question. Must the description of geographic areas to be served and the list of ADRCs be included in the one-page limit?
That's a good question. We did intend that that would be the case. However, if you need additional space beyond one page, that's completely understandable. But again, we want the project narrative to be as simple as possible. So if you have a long list of ADRCs, of course, you may need some more space to then explain the use of funds. But it is all meant to be just a one-page submission if it works out.
Related to that, we had a question come in saying, is one page single-spaced or double?
We don't
Hi,
have
Ami,
any
this is Joseph. Oh.
Yes, go ahead, Joseph.
Sorry to interrupt. Just regarding the question about the list of ADRCs, it was a good question. The applicant has the ability to do any attachments that they want. So the list of ADRCs could be an attachment if it is taking too much space. That's all.
Yes, thank you. And as far as the question about single space or double space, we don't have any formatting requirements. Again, just really trying to make this as simple as possible. So any format you want to submit is just fine.
Okay, we have another question. Could you talk more about the rapid assessment requirement? For example, would we need to be collecting and reporting data to ACL as part of this process? And is this likely to be the kind of information we already have as part of our work with the state-level emergency response planning, or will it require additional surveying and collecting of new data?
So that's a great question. We definitely know that some states have already done a lot of rapid assessments to understand the needs both for the workforce, but also for the populations in need. And that can certainly be what you use to determine how to use funds. However, if you wanted to complete additional assessments, we do have a few other ideas. Part of it could be completing a survey of your local staff and trying to understand their workloads and what their specific challenges are related to working remotely. You may also do an assessment of the population needs and the services, such as evaluating wait lists and if anything has changed or if there are certain services that did not have wait lists before but now have wait lists as a result of COVID-19, and keeping track of that. You may also assess populations at risk for social isolation. And so part of these assessments, again, is to provide some technical assistance. So we will share some examples, and I think shortly after all the funds have been sent to states, we will coordinate to have additional webinars or group calls to be able to share this information. But as far as submitting data to ACL, we don't have that requirement now, but we'll be sure to inform all of the grantees soon after the funds have been sent out.
Ami, can I add one additional point?
Absolutely. Go ahead, Joseph.
Embedded in that question was a really good insight in terms of what if part of the state's overall strategy with FEMA or their emergency response, they're doing additional assessments. And so can that be used? And so the answer would be definitely yes. In fact, in the FOA, there is language that hopefully the applicant would make sure that they would reach out or identify those activities so we're not duplicating efforts. So I just didn't want to lose that point because that was a really good insight in that question.
We've had a couple questions come in about the timing. Could you provide information about the start and end dates of the project period? There's also a question, this is a 12-month grant. Is there consideration for a no-cost extension? This is very fast.
Yeah, great question. So the project period will begin from the moment you receive funds. So again, our ultimate goal is to send notices of award by the end of this month. So the project period might begin May 1st and be 12 months from there. And there will be an opportunity for no-cost extensions, as with normal grants. However, we expect states to expend all of these funds fairly quickly, but that option is open.
We have another question. May we propose / set aside funding in our budget to do a post-pandemic SWOT analysis?
That's, I think, absolutely appropriate, and that's a great point to bring up. There will be plenty of needs even after things slow down or once the number of cases goes down, and so I think that's absolutely appropriate given that this is a 12-month time frame and there might be some time to do some post-assessments. So that's a great idea.
What if a state does not have an ADRC system and operate INR, et cetera, at the state level? Can they apply and receive funds anyway?
That is interesting. Joseph, may I ask you to answer that question?
Yeah, when we mentioned that information referral done at the state, it's at the state in the broad terms. It's not, the INR doesn't have to be performed by the state agency. Is, you know, information and referral being provided anywhere in the state. So it is possible a state agency may not have a 1-800 number, may not provide INR in-house, but yeah, they definitely would be eligible to apply. The assumption was there is information referral happening in every state. And so hopefully that helps answer that question.
A related question that came in, what is meant by, quote, states with established ADRCs?
Can we take that one on?
Yes. So ADRCs are defined in statute in the Older Americans Act. So you can refer to that definition, but as Joseph said, we're looking for anyone providing those access functions such as information assistance. But the designation of ADRCs is really up to how the state designates them. So we're not saying they have to be designated by statute. It could be, you know, that all AAAs are designated as ADRCs. That's certainly up to the state. But again, that's why we are asking for a list of those ADRCs and asking for their geographic area that they serve.
Can the ADRC partner with local nonprofits, or must it be administered by the ADRC itself?
Yes, we are encouraging partnerships outside of the AAAs or ADRCs. So nonprofits that might be providing access services to older adults and people with disabilities is absolutely appropriate to subgrant with.
We've had a couple questions come in related to the state's no wrong door lead. So I'm going to read just a couple off that I think you can answer together. So one is, how do you find the state's no wrong door lead? Another one, would a statewide independent living council be an appropriate no wrong door system lead agency?
Yeah, those are great questions. So we expect that the no wrong door system lead agency would be a state agency. So typically that's the State Union on Aging or the Medicaid agency at the state level. So it would be important, if you're a local level organization, to reach out to someone at the state level that can help you identify who that is.
We have a question about the budget year. When does the year budget begin? May 1st, question mark. Are you considered to be a new grant or continuation?
So this will be a new grant. So applicants will, once awarded, they'll receive a notice of a grant award through the grant solution system, and that'll indicate the start date. So again, we anticipate May 1st, but that's not the hard date. We're going to work as fast as possible to process applications as we receive them. Again, why that application due date of April 15th is so important, because we ultimately want to send funds out to states as soon as possible. So hopefully on or around May 1st will be the start date.
Can the funds be used for activities or expenses that started prior to the grant approval or funding distribution? For example, March expenses to get ADRC set up virtually.
So unfortunately, funds can only be expended for the specific project period and the budget period that will be detailed again on that notice of award. So you won't be able to sort of back pay for any funding prior to that start date. However, if there are additional enhancements that need to be made to the virtual workforce, then that's certainly allowable.
What would the uses be when there are no local ADRCs? Would the state then be able to use the funds for these purposes?
Yeah,
and
so I think as Joseph...
Sorry, go right ahead.
Oh, sorry. As Joseph was mentioning, if there are other agencies providing critical access functions such as information referral, so if it's the AAA, the Center for Independent Living, the state agency applying for funds can certainly consider partnering and subgranting to those agencies.
Two related questions to how funding can be used. So can funds be used to purchase tablets and other equipment for older adults and persons with disabilities? And then second question, can funds be allocated to individuals below the age of 60?
Great question. So I think with iPads and any other sort of technical pieces like that, it will be important that you provide that justification with your budget narrative, just so we're aware of exactly how those iPads or other technical devices would be used. But it is appropriate, as in the example provided earlier, if it's related to assistive technology needs. But again, we will require a bit of justification to approve that. And I'm sorry, what was the second part of that question, Kristen?
Sure. The second question was about funds going towards individuals below the age of 60.
Yeah, I think for people with disabilities, we are looking at all ages, so that would be appropriate.
All right, another question. Do all AAAs across the state need to do the same activities, or can the state application outline that each AAA may utilize the funds based on their specific needs?
Yeah, it can be based on specific needs. So the state can choose how they subgrant to the local AAAs or other organizations. It does not have to all be used the same way.
We've had a question, a two-part question here. One, are administrative funds available? And then how detailed does the budget narrative need to be at this time?
Yeah, so with other grant opportunities, your budget can include things like personnel or salary as needed. But I think we're emphasizing that these funds should be subgranted out to local agencies that are providing the direct critical services to the population at need. And the budget narrative, again, given the short time frame, we don't expect too much detail. And we fully understand that the use of funds may change as we move along in the next couple of months or as things continue to change from state to state. So that's completely understandable. And again, through the TA that we provide ongoing, we hope to stay in touch with what those changes are to your budgets.
Another question, can ADRCs distribute these funds to disability service providers to help with workforce issues?
Yes, absolutely. I think they are definitely a critical partner in this situation. And again, we encourage you to partner with any organization within the state.
Another question, is coordination with state assistive technology programs required or encouraged?
That is strongly encouraged. We definitely know that states are looking to partner more with the Assistive Technology Act programs within their states, so it's listed there as a potential activity for use of funds.
Can funds be used to support initiatives that would benefit both individuals enrolled in HCBS waivers and individuals not on HCBS waivers?
Yes. So the use of funds is not dependent on whether or not a person is receiving Medicaid funding or whether or not they're in a waiver. This would be available to all populations.
How does one find out who is the main applicant within one state?
So yeah, that's a great question. Again, typically the applicants we receive who are designated as no wrong door system agencies are the state unit on aging or the Department of Aging in your state or the Medicaid agency. However, if you're having trouble with tracking down who that state agency might be, feel free to reach out to us directly and we can help you with that.
If a state asks for more funding than available, how will the funds be distributed? And we've also had another question requesting information about how the funds are allocated. I believe someone tried to find it through the FAQ link, but perhaps we can find the correct link to put in the chat, Helen or Fallon. But the first question, if a state asks for more funding than available, how will the funds be distributed? Yeah, so at this time we have just the total pot of $50 million, and so so we will be granting states the amount that they've been allocated based on the 6-tier approach, which again was done by a formula based on population of individuals who are 60 years and older and individuals of all ages with disabilities, and so states were broken out that way into 6 tiers. So at this time, we're not sure about being able to supplement any additional amount beyond that, but we'll certainly inform states if there is additional funding available. Does the entire state need to be served?
Kristen, if I, real quick.
Yes, absolutely,
just
go
question.
ahead.
So if a state wants to apply for more than what their tier amount is, they won't be penalized, and that's allowed. But we would only fund to the amount that we have, unless extra funds became available. So I just want states are allowed to, if they want to, they wouldn't be penalized if they do go over the amount. So I just wanted to share that.
Hey, thank you, Joseph. All right, the next question coming up was, does the entire state need to be served?
I think we certainly encourage statewide coverage, but we understand that there are greater needs in certain areas versus others related to possibly the number of COVID-19 cases and where the peak is at the time. And so we certainly leave that discretion up to the state.
Next question, is there a list of state ADRC contacts in order to facilitate the, quote, partnership with State Assistive Technology Act programs as stipulated in the FOA? We can provide the list of AT Act contacts upon request, and they can be found at a URL link that was shared for at3center.net.
We can also add them to the FAQ list, so people can just go there and find them as well.
Yeah, there is a technical assistance website which provides statewide information on AT programs, and we'll be sure to provide that widely.
What kind of data tracking will be required for allowable activities performed with these funds?
Yes, that's a great question. So there are reporting requirements specific to this type of emergency funding, and that can be found on page 12 of the FOA. So this type of reporting is specific to financial details of how the funds are being used, including how much is being subcontracted or subgranted out. So ACL is working agency-wide to figure out the format of how this reporting will occur. So we'll be sure to communicate with that to all of the grantees as soon as possible. But any additional programmatic reporting, again, we're we're working on the format of that, but ultimately, given the nature of these emergency funds, we certainly want to ensure that any type of reporting that we require is the least burdensome for states. So again, as soon as these funds are awarded, we will communicate that with all grantees as soon as possible.
Can local AAAs expect the funding to be passed through to the local AAAs, or will the funding remain at the state level?
Again, as a part of the requirements, our hope and our intention is that states will subgrant or subcontract with ADRCs and other local organizations that have a need in responding to COVID-19. So you should, hopefully the local ADRCs will receive that as a pass-through.
Can funds be used to educate populations about nutrition and prevention of chronic diseases?
Yes, absolutely. I think given that certain chronic disease self-management programs have been sort of temporarily ended since there's no in-person interaction, it's important to still educate folks about those critical needs, and so these funds can certainly do that to allow for, you know, virtual video calls or anything like that.
This next question is from someone who joined a bit late, so if this was covered earlier, it might benefit other people who also joined late. We thought we had saw that it was only one application per state. Is this the case? And if so, is it going to be something that our SHIPs will be able to apply for to provide a trickle-down effect to our agencies?
So yes, it is one application per state. As far as SHIP-specific funding, I'm not 100% sure on that. Joseph, do you have input here?
No, it would be at the discretion of the state what part of their access system they feel they need to support immediately. And so that might be some SHIP counselors are doing those access functions, but that's going to be at the discretion of the state, not dictated by ACL.
Another clarifying question. Are funds only available to designated ADRCs? How about emerging ADRCs?
That's a great question. And again, I think we leave that up to the discretion of the state to decide. But these funds can certainly support sort of the vamping up of ADRC sites, or if there is an agency that needs support at the organizational level, that's certainly appropriate.
We have a comment here. We have begun our narrative. Regarding pages 7 and 8, we listed all of the required items. However, some of the services listed in the additional items are not provided by our ADRCs, and some of the items may not be feasible. For instance, skill, time, technology to complete. Could you address the additional items, assuming they are not required, only encouraged?
Yeah, so again, the list of use of funds are just some potential ideas and some encouraging ways to use these funds. And so you're not required to list everything listed there on page 8. And we just encourage you to be as specific as possible, but again, not requiring too much detail on what is possible and how you might use the funds. But again, as we move forward and as we touch base again through technical assistance, we can certainly stay in touch about how things might have changed.
Ami, if I could add, first, kudos to the state for already working on their application, not trying to make the rest of your peers look bad. That's great. It's great to hear. But also, a more important point, we're going to respond to the applications, as Ami said, as soon as they come in. And so the sooner you are in, then the quicker the funds will go out. Typically in a FOA, they all come in, we review them at the same time, and then we award at the same time. But really there is an incentive to, if you are in need of these funds, which we feel you are, as soon as you get those in, you'll be further up in the queue. And so I just wanted to share that.
Speaking of the applications, we've had a couple questions coming in about the budget narrative applications to be using. So I'm going to read two off. Is there a specific budget narrative justification template that we should be using? They couldn't find one in the original documents. And then secondly, where do we find the form SF 424B and directions? Is 424B really section B in the back of the documentation? And then this person also asked about a specific budget narrative justification template.
Okay, yeah, and apologies for any confusion related to that language around the budget narrative. There is no specific template. You are to use any normal sort of budget narrative chart that you have before. There is a format outlined later on in the document, I believe pages 24 and onward, so you can use that. But again, it doesn't have to be a complicated budget submission. We just want to understand how you might use the funds generally based on category or cost category. And then to the other question about SF424B, so there is a website, or there is a page on acl.gov related to how to apply to grants. And there's a specific link there that links to both 424 and 424B. So we can be sure to include a link to that in the FAQs document.
If two or more ADRCs apply, for example, the State Unit on Aging and AAAs, will you notify back to try to get them to coordinate?
Yeah, we will make every effort to kind of communicate back with any agencies or that we may have received multiple applications for. But if it becomes overwhelming, honestly, I think the way to do it is to go with the applicant that we received first. But we will do our best to communicate back in case we've received more than one per state.
Do we need to submit separate budgets for the 2 federal fiscal years?
No, you do not. We just need one budget and one budget narrative for the entirety of the funds.
Are we allowed to submit attachments to serve as references? For example, an ADRC coverage map?
Yes, that would be great. And attachments are encouraged. Again, we say one-page submission, but of course, if you need more or want to include attachments, that is okay.
Are state AT programs also receiving relief funds?
I believe there was a proposal submitted, but Joseph, okay.
Yeah, not through this. These specific funds were designated for ADRCs. It's a fair question, but not through this effort.
Is ADRC and No Wrong Door the same system and are both eligible to apply?
Yes, that's a great question. So I guess a little history lesson, Aging and Disability Resource Centers was sort of the initial initiative and one of the first grant opportunities back in 2003. And as the model and the vision grew, it turned into a No Wrong Door system vision. And so that really promotes having a single access point across the state with coordination across multiple state and local agencies. And so there's more information about that on our actual No Wrong Door website. But yeah, they're both used interchangeably, but in general, we still are looking for one lead agency at the state level, whether that's the SUA, the Medicaid agency, and then as far as subgrants, that can go to ADRC or other organizations as the state may decide.
Could the funds be utilized for staff to manage the virtual outreach or phone calls to people in the community?
Yes, absolutely. We know that everyone is working in a different environment now with being remote, and so those capabilities are very important, and doing follow-up calls and so on. So that is an appropriate use of funds.
Can funds be used to do outreach to customers to know we are here during the crisis, so marketing, advertisement, et cetera?
Yes, absolutely. It's even more important to make sure that folks are aware of where to go and who to call, and your marketing strategy may be very different and have a different message, so that is a good use of funds.
Could funding be used to enhance food access?
Yes, and I think we have an example there in the FOA where we talk about using things like Peapod or Instacart or DoorDash or Grubhub. I mean, there's many different food and delivery service options out there. So that is an opportunity for using these funds as well.
Would it be allowable to use funds for rent assistance for people with disabilities that cannot work at this time due to COVID-19? I think the service-specific dollars, that will be up to the state and ultimately the subgrantee to make that decision. But certainly if it's related to COVID-19 needs and the immediate needs that folks might have at this time, I think it would be appropriate. But again, that's up to the state and the subgrant or subcontract processes. Will you provide examples of how ADRCs will assess people most at risk of COVID-19 in care facilities and hospitals?
That's a great question. There has been a lot of attention at the agency around what states are doing to handle care transitions, and especially, down the road as things calm down and more people are leaving the hospital after recovering from COVID-19. So we certainly can look into that as a specific technical assistance topic that we can share widely with grantees.
May funds be used for direct services to individuals that are not typical of ADRCs, such as purchase of food, pre-cooked meals, delivery of groceries, et cetera?
Yeah, so again, I think we did provide that example in the FOA on page 8, but food delivery and going to the grocery store is very different for everyone now, and so states and ADRCs could consider collaborating with local food delivery services or local restaurants to ensure that meals are more widely available, as we know that, typical home delivered meals programs are definitely a little bit different now. So that's a great opportunity.
In a similar vein, can the funds be used to provide meals for younger people with disabilities, in addition to using them to arrange for meal deliveries through Grubhub, et cetera?
Yes, absolutely. We're definitely, ADRCs do serve all populations and all disabilities of all ages, so that is appropriate.
Can the narrative be a list of activities only, or should an additional description be provided?
I think a list of activities is appropriate as long as it's enough information that we know it's being used for the purposes of this emergency. So we don't need any additional details in the one-page project narrative submission.
Are we supposed to detail the geographic coverage of each individual ADRC organization, or just indicate the overall coverage of ADRC across the state?
I think we want to know if it's statewide coverage of ADRCs, and then if it's not statewide, we'd like to understand which counties the ADRC serves.
In order to apply, would the ADRCs themselves apply, or would it be the Area Agency on Aging?
So local organizations such as the Area Agency on Aging or the ADRC are not eligible to apply directly for funds. However, they can partner and work with their state agencies to potentially receive subgrants through this funding.
Does the applicant need to be a specific state governmental unit or any other lead for the grant?
So we're asking the state to identify that lead agency. So it's not any specific type. Again, it could be the SUA, it could be the Medicaid agency, it could be a disability-specific agency. As long as it is a state level agency and there's just one applicant per state.
Our ADRCs are 100% state funded, and we are restricted by the legislation to only directly subgrant those funds to the AAAs. Does ACL have similar restrictions? For example, could an SUA directly subgrant these federal ADRC funds directly to the ADRC partner organizations or providers?
Again, the subgrant process or the contracting process is up to the state, and we know every state has a different process. So the designation of your ADRCs doesn't affect how these funds are used. So how that works is up to the state.
Are matching funds required?
No, matching funds are not required.
Food and meals are identified as a critical need. Can these funds cover ADRC staff delivering groceries, meals, providing grocery shopping assistance?
Yes, we think that would be appropriate. Again, the subcontract and subgranting details would have to be worked out with the state agency that's providing the funds, but supporting staff is appropriate.
Can a state focus on one population only, such as people with disabilities?
Yeah, so again, if the state decides, again, this is actually the purpose of doing a rapid assessment. And so if the state realizes that the greatest need is for individuals with disabilities, then all of the funds can be used for one population or another.
Can the lead state agency use all funds in contractual for the ADRC? I'm not sure if I'm saying that correctly.
I think it's trying to, the question is, can they subgrant or contract out all of the funds? And the answer is yes. So the funds, the state is not required to keep any funds at the state level.
Okay. How much detail is needed in the budget justification? For instance, categories, local allocation, et cetera?
Yeah, it would be helpful to have as much detail as possible, but again, we're not asking for too much. So as long as the budget is broken out into different cost categories so we can understand if it's going towards staffing versus being contracted out and so on, that would be helpful. But again, as much detail as you can provide given the time frame for the submission.
Is it possible for ACL to provide a contact list for ADRCs that provides a direct contact name and phone number?
So again, I think we can, so we don't have contact information for all local ADRCs. That would be something you have to get from a state agency, but feel free to ask your question directly and reach out to us if there's something specific you're looking for.
Can funds be used for salaries of current options counselors?
Yes, so funds can be used for salaries.
Can funds be used for statewide data collection / sharing systems?
Yeah, I think that's an appropriate use of funds. Again, some states are having to revamp their data collection systems or make enhancements to be able to track data specific to COVID-19 related inquiries. So that type of use is appropriate.
Can you share the role State Assistive Technology Act programs could play to provide assistive technology and also to proper assessments to determine the use of this?
Sure. So we do provide a description of that on page 8, but states are encouraged to partner with their State Assistive Technology Act programs to provide access to loans and devices, provide training to older adults and people with disabilities. There are various different ways that the ATX program can support telehealth technologies and so on. So again, please refer to page 8 and for more detail on that.
Can state units on aging use funds for state-level initiatives revolving around COVID-19?
Yes, absolutely.
We have 2 questions related to caregivers. So can we assist rural caregivers and persons with dementia? And also asking, can, I guess, caregivers be considered a population under this grant opportunity?
Yes, caregivers are certainly a population that's important and that ADRC serves, so that is appropriate.
Is subgranting out to other providers, in subgranting out to other providers, do they need to be only nonprofits or can they be private local businesses, ideally?
So I think they can be private local businesses. Again, the subcontracting is up to the state agency, but we probably would ask for a bit of a justification on who those agencies are that you plan to contract with, just so we know that, you know, they're providing similar services and that the use of funds is going to be related to COVID-19 needs.
So I've got one final question. Go ahead, Joseph. We're right at time.
Yep, I was just reminding the group. Okay, yeah, go ahead, last one. And but just to remind the group, we will have everyone's questions, so the ones that we aren't able to address, they'll still be part of the FAQ, and we can address them in writing. And so
the final question that I'm going to pose is, will a collection of these questions from the webinar be posted online or shared with participants? And Joseph was just covering that. So we do have
yes.
all of these, the ones that we haven't been able to get to, we will. So
yes, and so we will, we'll update the frequently asked questions. We appreciate you guys being patient with us through the rapid Q&A here. So please keep a lookout on the acl.gov/COVID-19 webpage. And again, we appreciate everything you all are doing at the state and local level to combat this pandemic. We're in this together, and we know you're dealing with a lot of new challenges. But as we close, we hope that everyone continues to stay safe and stay healthy. And of course, you know how to reach out to us if you have any questions. So thank you, everyone. And thank you to Kristen and the Lewin team for working through the technical difficulties. So again, thank you, everyone.